And healthcare workers have definitely had to do things a little differently, including how they provide care to patients.
This morning, we're joined by Imaging Director Marty Khatib for the Mercy San Juan there to discuss the effects of some of those changes. Hi, Marty.
Good morning. Thanks for having me.
You bet. Yeah. 1 year later, how have things changed? Because I think you had to do, of course, a lot of shifting with the pandemic.
Yes, absolutely. Just a quick background, NASA issued a study several years ago that outlined healthcare errors and avoidable healthcare errors as the third leading cause of death in the United States. That was a significant finding, and I think from that point, that was our sort of warning that there was an issue here. Dignity Health actually responded very well to that by introducing a program called Hello Human Kindness that I'm sure you've heard of. That really emphasized how our people need to have core competencies such as not just compassion, kindness, and empathy that are very important, but also proficiencies and competencies in their jobs, no matter what they are, at every level. So that sort of started a journey in patient safety for us and really set the foundation that was now followed for sustainability reasons through hospital healing hospital certification, as well as HRO, which stands for high reliability organizations. All of those are now in place to make people feel safe. And then came COVID, which completely turned our world upside down.
We're looking at pictures there. You could see when Arco Reno was transformed early on.
Yeah, so that was actually about how we partnered Dignity Health with Governor's Office, because one of the biggest concerns very early on was capacity at hospitals. And I remember how we were very excited to partner with Army Corps of Engineers, as well as the Governor's Office, to provide remote teleradiology capability with a matter of 48 hours. So all of our investments, training throughout the years paid off very quickly in this very uncertain, difficult situation. So by that, we were able to get about 300 to 400 extra beds into our community, and that actually was very helpful. We were able to provide assistance with radiology technology. So every patient that would come to the field hospital there at the Sleep Train Arena was able to get a chest x-ray and have it interpreted very quickly.
Marty, we got about 30 seconds left. The role of telehealth also changed a lot of things for people.
It did, and I think the fact that now we were able to ramp up quickly, mobilize with virtual visits, they're very helpful. What I really want to do is get the message to folks, to viewers, that if you're delaying care, now is not the time to forego early detection, routine screening. So virtual care will help you identify whether you should come into our hospitals and clinics. We are completely compliant with CDC standards. You will see tremendous effort and scrutiny in screening processes. So you are safe coming in. So we don't want to delay and lose the opportunity for early detection that will get you the right treatment and right intervention so you can recover from those unforeseen situations.
Yeah, well, thank you so much. Thank you. Nice to see you. Marty Khatib there, Imaging Director, Dignity Health at Mercy San Juan Medical Center.
Thank you.
All right.
Thank you.
Thank you.
Appreciate
it. And their campaign is just so heartfelt,
Right.
It really is. All right, there is a beautiful home that could be yours if your bank account allows it.
We're getting the grand tour.